Dr. Gaza here. We got Callie Jr. We're doing some injections here. Today we're going to do the cluneal nerve blocks on him after a severe rear end injury. If you look at the screen over here, you can see a spinous process in the middle. He's got a little bit of spinous process bursitis in the middle. There's the left side, right side of muscles. We don't see any hematomas. We're going to do the facets later because his extension pain is better, moderately, but he's still limited. So we're waiting for the MRI, but I can tell he's got facet pain. We'll do that under x-ray. But if I follow that middle spinous process out, like the letter T, is ILIOLUMBAR ligament coming out off L5 and attaching on the iliac crest, and you can see he starts to get edema right there. And that's right where the middle cluneal nerve comes off that runs down into the SI ligaments. So, look back at his back now. We're going to slide this on the ultrasound probe. You're going to feel a little pinch here. Shouldn't be as bad as your tattoos, okay? And then you can go back to the screen. Little pinch, 3, 2, poke. There you go. And here comes the needle right there. And we're going to inject right there. 3, 2, no. That's the spot, isn't it?
Ooh.
Yes, sir. All right. Doing okay? All right, and there's a needle right there. 3, 2, 1, a little bit right there. And when you see that swelling in the SI, in the iliolumbar ligament, just kind of spreads out. There we go. Yeah. All right. So just put a little bit, very low dose steroid. We don't want to weaken it. You can do Toradol too. And if it comes back, we do PRP. And so that we're just going to come down here a little bit. Doing okay?
Ooh.
3, 2, 1. There we go. All right, good job. Now we're going to go to the right side and follow the ligament out. Doing okay?
Feel like a pinch when you put it in.
That's why you felt the comment card before the injection. All right, there's the spinous process again. You can see a little bit of bursitis. We're not going to inject that because that's minimal. We just did laser on him. It's infrared, both LED and laser. But so the fluid's there, but it's desensitized. Now I'm going to follow it out to where it attaches on the iliac crest, and you can see the ligament coming right there, and it gets a little swollen up there. I don't see tears in there, but you see a little bit of fluid. It gets darker right there. There we go. Boom, right there. You ready?
Mm-hmm.
Okay, my man. Deep breath in. 3, 2, poke. There you go. Good job. All right. There we go. Ready?
Mm-hmm.
All right. And go. There's a needle right there. So I'm not trying to inject definitely in the tendon, just right above it. And 3, 2, 1. Doing okay. Take a deep breath. Don't hold your breath. You got it. 3, 2, 1. And 3, 2, 1. Now, if I want to do PRP, I'll actually go pepper the edge of the tendon. All right, so now we're going to go out of plane, fall up to the top of the iliac crest, right where it attaches. I'm pushing out now. How's that feel?
I'm done with that needle.
We're almost done. I'm just going to hit the nerve now. Now we're going to come out of plane and come right below it and get the middle cluneal nerve right here. Deep breath in, 3, 2, 1, poke. You got it. Good job. All right, there we go. So you won't see the needle, you'll see a little pinch. But when I put the volume in, deep breath, don't hold your breath. All right, so now, if you look over here, you don't see a lot of fluid, but we put it. Good job, you're done, yeah. So, over here, he's a young, healthy guy. He doesn't have a lot of atrophy, but we're gonna keep an eye on these muscles too. Deeper down, he's gonna have the facets, and this is the middle of the back, the spinous process. So you see that little bit of fluid. Yesterday, that was a lot more palpable, but it's not painful because the truth of the matter is that when you use the infrared, it desensitizes a lot of the pain fibers, vasodilates, pulls most of that inflammatory crud away, so the nerves aren't as sensitized. So now we look over here, there's a ligament where it attaches, and don't use a lot of volume. You want to keep the medicine local. People flood 20 cc's in there. So now when I'm pushing on it, come up on your elbows now. Extending, put your elbows at the table. I want you to hyperextend your back. So yesterday he had about less than 5 degrees of extension. Okay, good. Do your pelvic tilt, pinch, drop. That's excellent strength. And do the tilt. Okay, now do the reversal. The guys at curve. Good. You see how much you got? 10 degrees, 20 degrees? Any pain there?
Mm-hmm.
Okay, now do the opposite. Get rid of the pain like we showed you. That's it. Lift my finger up. Now how's the back feel there?
Mm-hmm.
Better? Yesterday's scapula, we're all the way out here because whiplash tightens the pecs and pulls you forward. Head comes forward. You get the cervical facet pain, C2, 3, and C3, 4 here, C5, 6, or 8, 80 here. When you can get the scapula pinched in and down, which she was barely doing yesterday, 24 hours later, squeeze my finger, drop it, yeah, hold my finger, pull them together, and lower my finger toward your butt. That's how you heal the upper half, and then when he flips the pelvis here, heals the lower half. That's what we call neutral spine. All right, good job. So we'll see how he's doing tomorrow.